Dr. Malika Woods, medical doctor and healthy lifestyle strategist at Dr. Woods Wellness. Super excited to be joining you today. We got a hot topic today, which is the keto diet. Is it a miracle or a mistake as it relates to your hormonal health? I do want to give a medical disclaimer before I dive in here that everything I'm sharing with you is for educational purposes only. I am not establishing a doctor-patient relationship by sharing this information unless you've actually seen me on the office side. All right, so first of all, and here's what we're going to dive into as it relates to keto. We're going to talk about the pros and cons as far as what are the benefits, what are the side effects, what are the risks. We're going to talk about common pitfalls or mistakes that people make when they do keto. And then we're going to talk about some healthy alternatives as well. And let me say this too, I'm really not a strong component of the idea of a diet even. That's just still the terminology that we use. But what I really like to talk about is a meal plan that you're going to follow. And I'm really interested in finding something that is sustainable for you, because there's always something that you could do for a period of time. I don't know, some of you guys may have done like the cabbage diet, or you've done the HCG diet. You've done things that weren't meant to be sustainable. And so we're going to talk about what can you do really to sustain. So first of all, let's just talk about what is a keto diet in the first place. So definition, a keto diet is basically a low carb, high fat diet. And the idea is that you're trying to get your body into a state of ketosis. And when your body is in a state of ketosis, that means you are taking stored fat and burning it as energy, versus what your body commonly does is taking carbs and burning those as energy. The standard keto diet, you may be taking in 75% fat, 20% protein, 5% carbs. So it is severely carb restricted. And 20% protein is on the low side for me and what I recommend for a lot of people. And then the high protein keto is where you have, instead of 20% protein, you do 35% protein, but you still keep your carbs at 5%. So one of the things I think some people are probably making a mistake in right away as it relates to trying a keto diet is that they're probably not really getting in that much fat. They're probably doing more so of a low carb, which is great. I think low carb is the way to go over low fat. So back in the, I don't know, 80s, 90s, there was a big push for low fat diets. And I think that the data has been pretty good that low fat diets really aren't the best. It's really about lowering your carb intake. And so I'm also going to talk about alternatives like paleo, and both paleo and keto are low carb plans. It's just what is on and off the diet is different. So then if you're going to do keto, these are the things that you're supposed to avoid, like sugary foods, like soda, fruit juice, etc. Keto is no grains, no starches like rice, pasta, etc. There's really very minimal fruit on keto, because even if you have a lower sugar fruit like berries that are okay on other plans, that's going to automatically get you up to 5% carbs very quickly. So on a keto diet, your fruit would be very small portions of like berries, no beans, no legumes, no root vegetables like potatoes or carrots, low fat or diet products, none of those, and no unhealthy fats. So those are the things that you're going to avoid when you're on keto: no alcohol, no sugar-free or diet foods. All of that you want to avoid if you're on keto. Some of you might say, well, goodness, if I can't eat all of that, then what can I eat if I do keto? So the things you can't eat on keto are meats, fish, eggs, cheese, and this is the one that I actually have issue with. I'm going to get to that in a second, because again, we're talking about things from a functional medicine standpoint. And from the functional medicine standpoint, dealing with inflammation is super important. And so this is part of the reason why keto is not my favorite, because of the cheese piece. Nuts and seeds you can have on keto, healthy oils like avocado oil, extra virgin olive oil, of course, avocados, condiments. So what are the benefits of keto? Why is this such a popular diet? And there actually is some good data to support some of the benefits of keto. So it is definitely shown that going on a keto diet will lower blood sugar. So for those individuals who may be pre-diabetic or diabetic or worrying about blood sugar, definitely going on keto can help with that. Increased weight loss, definitely if you compare a keto diet versus the old low-fat diet, you're going to lose more weight on a keto diet. And then also those ketones that you produce are supposed to provide energy for your brain. So those are some of the benefits. So what are some of the other benefits? As far as heart disease is concerned, the ketogenic diet can help improve your HDL good cholesterol level. Also can help with blood pressure. There are even some studies that are looking into whether or not the ketogenic diet is more beneficial for someone who has cancer. And so what's interesting about that, it's actually the lowering of the blood sugar, lowering of the insulin resistance that might be linked to better outcomes as far as it relates to cancer, because a lot of cancer cells feed off of sugar. So it's important to note, and I want you to see the common theme as we're going through and talking about the keto diet. How do we get the benefit? A lot of it is from lowering blood sugar. There has been some benefit as far as Alzheimer's disease is concerned, as far as reducing symptoms. And some of you may be aware that Alzheimer's has been called type 3 diabetes. Again, Alzheimer's has been called type 3 diabetes. And so it's important to note that one of the root causes of Alzheimer's has to do with blood sugar and insulin resistance. So again, no wonder that going on a keto diet or some sort of a diet that would reduce blood sugar can be helpful in that. Epilepsy and seizures have been shown to have some benefit on a ketogenic diet. Some of you may have maybe had children or have friends and family who had kids who had seizures, and they were recommended a ketogenic diet. And then polycystic ovarian syndrome has been shown to potentially have some benefit as far as a keto diet. Why? Because PCOS or polycystic ovarian syndrome, one of the root causes is insulin resistance. And if you can correct that, you can often see some benefit in the disease. So I hope that you can see that really a lot of these benefits as far as keto is concerned is really about lowering blood sugar. So that is really my take-home point as it relates to keto. Now, on the flip side, for those of you who did try keto, did you have any unwanted side effects? Did any of you experience what is called keto flu? So there's something called keto flu or ketogenic flu that you might experience in the first week or the first few weeks going on a keto diet. And the reason why you're experiencing that is that your body is trying to get adjusted to the fact that you're using fat to produce energy versus using carbs.